As a GP for over 30 years, obviously Charles gave an awful lot to his individual patients, but I think Charles realised quite early on he could give even more. He's mentored some of the Macmillan GPs in the central southwest area, and they've gone on to do education programmes locally, which has upskilled hundreds of their GP colleagues.
In my time as a GP educator, it became increasingly apparent that one needed to actually focus the education on the whole team rather than GPs. We ran what we called a masterclass. We had GPs, practice nurses, social workers and some of the emergency care practitioners actually learning about each other and how their roles complemented and fit. So we actually got people saying, I really didn't realise that nurses could do this, or nurses saying, I didn't realise GPs worried about these things. We became aware of how many patients were reporting a sense of abandonment as they came to the end of primary treatment. We discussed this within the Macmillan Strategic Group, and we were invited to pilot a course for practice nurses.
We all admitted on the course that we shied away from the subject and often would perhaps not bring it up rather than cause distress to the patient. And actually at times, by not bringing it up, we were causing distress. We all felt that once we had the confidence, we could move forward to giving better patient care.
One nurse said it was transformational for her because she could sort of release this other role because they already have the skills. They just needed reframing and some additional knowledge just to make them more confident.
We can't now keep up with the demand for other areas that want to run the same course.
I think another aspect of the work that I think we've learnt from is supporting GPs in having the challenging conversations as people start to approach end of life. One of the best ways of giving people hope, even those who are approaching their end of life, is to give them a sense of control and choice over what happens. We've worked in partnership with an organisation called Dying Matters, giving GPs the skills to have these really quite difficult conversations.
Charles is a hugely admired colleague. Apart from his work with Macmillan in the UK, he's done a huge amount of work abroad in Tanzania for patients with cancer and end-of-life needs. And on a personal level, I would say Charles has really supported me in my role, always encouraging me because he knows that the work that we're doing will have such huge benefits for all our patients.
I feel I've been very privileged to have the opportunity to work with Macmillan. It's a very supportive environment. Seeing that what you're doing is actually making a difference to patients on the ground is very important and very fulfilling.